And we've been talking about that fiscal cliff for weeks now, and as we've been reporting, the looming fiscal cliff is a package of automatic spending cuts and tax hikes, and it's set to kick in next month unless President Barack Obama and Capitol Hill agree on some way to stop them. The president and congressional Democrats have said they will reduce spending on entitlements, including Medicare. To talk more about the impact on health care, we are joined by Dr. Poonam Alaigh. She is a medical expert and friend to Ebru today. Good to see you. And all right, let's get down to business here. If we do have a deal that is struck, how is that going to affect Medicare patients?
Yeah, it's funny, we've been talking about avoiding the fiscal cliff, right? But the important thing about healthcare is whether we avoid it or we can actually deal with a solution, healthcare is going to get impacted. And it's funny, I was talking to one of my patients last week, and his advice to me was, whatever we do, we have to make sure that the element of humanism is not lost in this translation when we're talking about healthcare, because healthcare is so personal to each and every one of us. So if we do come up with a deal and we avoid the fiscal cliff, the entitlement programs are going to get affected. The federally sponsored healthcare budget will get impacted. There are provisions around capping the federal spend on healthcare. This includes Medicare and Medicaid. We've talked about Medicaid, and what a lot of the Republicans in the states are talking about is coming up with a block grant. So each state is given a certain amount of money by the feds, and the state then decides how they want to spend that money and how they want to design their benefits.
Now, there are already some proposed 27% cuts in Medicare payments already scheduled to hit doctors in January. So this is going to be, this fiscal cliff, if a deal isn't struck, that's going to impact them even more.
Absolutely. So that's sort of if we don't come up with a resolution, then there are going to be some immediate impact to our healthcare system, one of which is the 27% automatic reduction in Medicare fee schedule to providers. This is called a doc fix, and this happens every year. But if there is no resolution, we're going to see sort of a domino effect where physicians are going to get less reimbursement. Physicians then may choose not to see our Medicare patients, and the entire healthcare community and healthcare professionals can get affected by that.
Let me ask you a question. We saw our reporter Kyle Schmoyer asking people, are you worried? What about the doctors? Are you worried personally?
I think we as physicians are worried, no matter what the situation is, because healthcare reform is happening. If we avoid the fiscal cliff, then there are repercussions also in terms of how we're going to get paid, in terms of whether Medicare beneficiaries will be able to afford their care, because one of the provisions and one of the negotiations that the President and Congress is having is looking at the Medicare benefit and seeing if we can actually start doing cost shifting to the Medicare beneficiaries. Can we increase the eligibility age for Medicare beneficiaries from 65 to 67? Can we look at bringing about program efficiencies and maybe looking at certain procedures and putting prior auths in those procedures?
Let me just ask you a question. You said 65 to 67, that's certainly one solution, but you know, you're a doctor. If you could play president today, what would you suggest?
I would suggest a combination of things. Obviously, our longevity has increased, so there may be some room and some flexibility around that, around our Medicare eligibility age, but also 30% of healthcare dollars are non-value-added services are actually inefficiencies in the system. I would focus on those inefficiencies in our systems, look at how we can bring information technology together, how do we remove redundancy, how do we pay for appropriate care at the right time, how do we get our patients more engaged, how do we empower them so that they become more healthy in taking care of their chronic diseases. So
preventative care also.
Absolutely, that's going to be key, especially as we're living with chronic disease. That's going to be a key component.
What about Medicaid? Is that going to be affected in any way?
Medicaid, again, for the fiscal cliff, it's not going to get affected.
Okay.
That's one program that doesn't get touched by it. But as part of negotiations to avoid the fiscal cliff, Medicaid is huge. And again, that's sort of the Medicaid block grants that we're looking at. And a lot of the states are looking at ways to be able to come up with what the solution is for their Medicaid patients and not have the feds become prescriptive in terms of what those benefits should be.
Now, if no deal is reached by January, what about medical research and things like that?
Absolutely. That's a great point, Mia, because the institutions like the NIH and the CDC get impacted. They get a lot of funding. And if no deal is reached, there's 8% across the board cuts cuts to these agencies, so we're going to have impacts on food safety, surveillance, disease screening, in terms of nutritional programs for pregnant women and children, and research for chronic diseases where we're looking at cures and also looking at solutions to prevent progression of disease like diabetes, cancer, Alzheimer's, autism, things like that.
What is your greatest immediate concern then? I mean, not besides what you're saying, preventative care could go away. We could see all sorts of things. What is like the number one thing right now? If there is no deal that is struck, what are you going to do in the new year?
I think the immediate concern is really what's going to happen to our healthcare facilities and providers. They're going to get cuts in reimbursement. Access to patients is going to be an issue, and it's going to result in a domino effect. The economy gets affected, healthcare professionals, unemployment, and already a weak system becomes weaker because we don't have enough resources.
But is there anything doctors can do right now to prepare?
I think doctors are working together. The professional societies are collaborating. So you see the Hospital Association, the AMA, all of them, the nursing societies, all coming together and raising the awareness and really reaching out to the legislators to make sure they understand what the implications are to everyday Americans.
Well, it's certainly going to be very interesting and actually pretty scary for the American public also.
Absolutely.
Well, thank you, Dr. Poonam Alaigh, always a friend here at Ebru today, and thank you so much for joining us
Thanks
here today.
so much, Mia.